All right, we have Dr. Nitya Mani, MD. She's a board certified child and adolescent psychiatrist at UT Health Austin Pediatric Psychiatry at Dell Children's. She specializes in integrated care. Additionally, Dr. Mani is an assistant professor in the Dell Medical School Department of Psychiatry and Behavioral Sciences. Dr. Mani is the associate director of the Child Psychiatry Telemedicine Program at Dell Children's Medical Center. Her clinical interests are providing comprehensive, compassionate care for children and their families through outpatient work and collaborative care models. It's fabulous. Just up the alley of CFAN, right? And then we have Dr. Pooja Patel. Dr. Patel is a PhD, and she is an assistant professor in the Department of Psychiatry and Behavioral Sciences and an assistant director of the Child Psychiatry Telemedicine Program. She specializes in cognitive behavioral therapy with youths dealing with anxiety and depression, as well as in medical coping of adjustment to chronic illness, pain management, and in adherence to ongoing medical regimes. As part of the clinical faculty, oh goodness. Dr. Patel is also involved in the training program, which includes teaching and supervising future clinicians. So thank you both so much for joining us today. And we can't wait to hear what you have to share with us. Take it away.
Great, thank you so much. So it's really, really exciting to be here today virtually and to speak with all of you. Like Dr. Martin said, my name is Nitya Mani. I'm a child psychiatrist, and I have Pooja Patel, who's a pediatric psychologist, here with us today. And we wanted to talk about the management of pediatric mental health concerns across school and primary care settings. We've aptly named it Schooling PCPs. I'm really excited that there's so many different types of providers here today. And so this talk is really geared towards PCPs, but I think a lot of the things we'll talk about are applicable to many different disciplines. I know that we have some school ISD people as well, and really appreciate you being here. I think when we talk about some of the school processes, you would probably have way more detail than we're gonna go into today, but I really welcome you and appreciate that you're here. So the goal of our talk today is to explain the types of mental health accommodations available within the school setting for different diagnoses. We also want to talk about the different types of school-based interventions for specific diagnoses. And lastly, specific ways that PCPs can coordinate with school staff to care with students with mental health issues. And so as we all know, the mental health of children is a really important topic. And we know that mental illness within children is very prevalent. So the kind of most staggering statistic is 1 in 5 children from ages 0 to 11 experience a mental disorder within a given year. Additionally, 10% of those kids are having some impairment in their daily functioning at school or at home and in the community. So it's really affecting how these kids are functioning and affecting their well-being. And as all of you know, being in the field, it really is a ripple effect. So it really affects kind of their life overall. And here's just some statistics about the commonly diagnosed mental disorders. So ADHD, behavioral problems, depression, and anxiety. We will talk a little bit about the accommodations for those, but just to put this up here, just to kind of remind ourselves of the prevalence of these illnesses. And so one of our goals and one of the reasons we wanted to put this talk together is for children. They really have 2 broad safety nets, and they're public institutions that really buffer the effect, the length, and the severity of childhood adversity and trauma. And those 2 safety nets are schools and their PCPs. And so schools are somewhere where children are required to be almost every single day. They have a lot of contact with trained professionals there. And similarly, a lot of kids are seeing PCPs or some sort of primary care provider fairly often. So these are 2 places that have a lot of contact with these students and essentially the general population, so all of the students. And so it's really a great safety net to help manage the mental health care of these children. And so we wanted to put the 2 together and really think how we can tighten up that safety net so the 2 are collaborating.
So as part of our talk, we wanted to kind of just go over, especially in the primary care setting, you're thinking this child needs accommodations or needs help. So we just want to go over kind of the school speak and what that looks like. And there are two main ways that kids get accommodations in schools, and one of which is a 504 plan, and that is actually embedded within Section 504 of the Rehabilitation Act. And it's a civil rights law, and it prevents discrimination. It's not just limited to kids. And it protects all people who have physical or mental impairment, which substantially limits one or more major life activity. So for instance, learning in the context of kids in schools, and that there's a record of some impairment. So that's where primary care doctors come in, potentially helping diagnose. And it's causing some sort of impairment in functioning. So there is an impairment that's available. And the goal of the 504 plan is actually to remove barriers and create learning opportunities. When we think about 504s, you're really thinking about adjusting the environment to help the child succeed. So a great example of that would be a kid that is in a wheelchair without any neurological impairment. And a 504 plan would allow for accessible transportation, if we're back within the school bus, and then within the classroom and then within the school, making sure that they can accommodate all the places they need to go. Perhaps any sort of like leaving class early so that they can get to their next class. 504 accommodations also target hidden disabilities. So for instance, low vision, poor hearing, heart disease, kids with chronic illness, such as cancer. Conditions like ADHD are very interesting because they can be covered with 504 or also under IEPs or special education. And so in the instance where a 504 plan is appropriate for a kid with ADHD is when they don't necessarily need a change in their educational instruction, but maybe more just support in their environment. And we're going to talk a little bit more about that in our talk. But that brings me to the next category of providing accommodation, which is under the Individuals with Disabilities Education Act, IDEA. And so that's where that IEP plan comes in. And this is a federal education law that was passed back in 1975. And essentially it creates, if you have a diagnosis, it will then ask for you to specify in a category of disability in order to get that accommodation within schools. So there is a specialized need and support. And in this plan and kind of this way, kids are allowed to have individualized instruction and specialized instruction to support their needs. This is just a slide to show the different categories that exist where kids can qualify. And what I wanted to show you and what we wanted to kind of talk about as we go through our talk is just no matter what the accommodations are, the goal of both types of plans is to provide that support for kids. So parents do participate and have to consent to have their child evaluated. There's no cost, these are all free. And it's really meeting the needs of the child. Something to keep in mind is IEP plans and IDEA is federally funded. So it's required for public institutions to implement, whereas 504 plans also are implemented within private education settings as well as public education settings. But we just want you to know that regardless of where students are, and in my experience, schools have been wonderful in accommodating and supporting student needs. And so just in a primary care setting, really helping parents to identify what that is and supporting them to get that need met. So just a general quick overview of what that process looks for qualification of accommodations. And of course, this is just, again, bird's eye view, but whenever there's a need that is noticed, the referral concern, it's recommended that it's put in writing. So, if there's a need, like a learning need, we recommend that parents submit it in writing for the schools so that it's kind of on record and it starts a clock that then schools can then start the process, the formal process they need to do. And then the screening box is kind of where primary care physicians step in and kind of help and can provide information to support the schools. So that might be by providing data like school medical records or diagnoses or any sort of written documentation that can help the process along. The schools then go in and do their evaluation. Outside information and referrals and evaluations can be helpful, but oftentimes schools want to do they have kind of a formalized process that they're doing as well. And so they will take all of that data and put it together and then use their components that they need to then just come up with the best kind of plan for that student. And so as a team, they will decide with the parents and collaborate to develop what plan is best. So whether that be with an IEP or 504, and then kind of implementing that in real time. And the thing to know about these plans is that they're updated. So IEP plans are generally updated every 3 years. And they also can be sooner than that if there's a need that arises for kids, because we're continuously, things are changing and kids need support. So as we're thinking about schools and school support, schools are an amazing place with lots of resources and support. And so this is just a helpful slide to just talk about, there are a lot of things that are being implemented in schools, and just to bring your attention to that, even though we're going to focus on the top tier of this triangle, school-based prevention and universal interventions for all students. So that can be like social emotional learning. They have different groups and just available to all students. And then there are students that can be identified like through preventative measures that are being targeted with behavioral and emotional concerns. When we look at at-risk students, there's oftentimes supports within schools to provide therapy or meet with counselors to support those students in their mental health needs.